I already knew that we could, but I recently researched this through a sapling nursery fund from Médecins Sans Frontières. I went to northwestern Nigeria, and we tried to incorporate the stories that we heard from the communities. So we interviewed people in communities. We talked to imams, traditional healers, mothers, fathers, patients. And we used those stories to learn about the beliefs and the spirits and everything that's important for people to know as we're talking about their community and their sense of life. So we came back with 50 stories. We looked at the repeating patterns in those stories and the words that people used for this specific disease. And then we went back into the community and we asked two groups of people. It was a Muslim community, so a male and female group. And we said, if we would have to tell a story about this specific disease, who would be the hero? What would stop that hero from getting better or not contracting the disease? And what would help him? And now they co-created a story in which we put all the patterns of the stories that we heard and MSF's target story. We need less disease, get children in sooner. And that became the story of Abu Bakr. And that story, the health promoters took with them into the field when they visited the villages. And they narrated that story based on what they heard in the villages. And now it became their story. And the villagers recognized in the story of Abu Bakr their own words. This is where I have a problem with storytelling and myths, because this is really a true story. It's based on a story stories that people tell each other anyway. So they recognize it. It is not a myth as such. It's a co-created story of change, which is what we called it. I think if you incorporate the story that you co-created into your official stories, then you bring the two worlds together. So definitely that will be adapted and put into written stories or indeed workshops for the health promoters, yes. We're all storytelling people. It's the way we make sense of life. The only thing that we don't do within a clinical world is first listen and then co-create the story together with the patient. So it can be done one-to-one, it can be done in groups, and it can be enforced within your strategy of vaccine hesitance or uptake. One of my colleagues has been writing about this endlessly. She calls it narrative medicine. Doctors should learn to listen in a different way and co-create a story of health together with their patients. Because once they internalize the story, they will share it and they will carry it. It's theirs. So it's not just the doctor telling the patient what to do, but it works the other way around. And that's what you want, because that patient will narrate that story in his or her networks. It'll then move. So it will definitely work on all different levels. We don't just need data and evidence. We can also listen and let things happen and change it that way. So I want that uptake up. I want the skepsis down. And I believe that this is one of the things that we can do it with.